Loading. Obviously every doctor's schedule is subject to some interruption and emergency, but nevertheless we have to consider a model for the new generation. While research has found it is better for people's health to see one doctor continuously, many Australians, of all ages, are unable or unwilling to see a single general practitioner. Instead, they are jumping between multiple doctors, sometimes at multiple practices. Everyone is under pressure, said Victorian GP Cameron Loy. We live in a society where work and schools and all the other things that consume our lives do impact on how we attend to our own health care needs. That is a challenge for general practice, and it's important for all of us that Australians make some priority of their health. Julian Ray, the new president of the AMA in Victoria. Photo. Justin McManus. Doctors are keen to help find a solution, but are hamstrung by a lack of funding for innovative consultation methods, including video appointments, and a shortage of GPs in some areas. That means in order to offer early or late appointments, they would have to work even longer hours. University student James Hearns estimates he has seen up to 9 different doctors in the past year, simply because he is not always able to get an appointment with his regular GP, who works from 9 a.m. to 5 p.m. If I know I'm going to need a prescription and need to speak to him, I'll book 1 week in advance, otherwise I know I won't have the chance, Mr. Hearns said. For emergencies, though, he's a bit out of reach with how busy he is. There is now growing support for the introduction of virtual GP consults, to complement traditional services. Dr. Loy, with the Royal Australian College of General Practitioners, said that while face-to-face appointments would remain the bedrock of medicine, in some situations general practitioners could have telephone or video conversations with existing clients. That can also be done without having to have the clinic open. You could do it from your couch. You can do it from your kitchen table, Dr. Loy said. Jenny Dorr, director of a health startup incubator in Melbourne, already attends many of her doctor's appointments from the comfort of her own office. She is one of the patients of online GP clinic GP2U, where she consults with the doctor via video link, mostly to get scripts for her asthma medication, which are sent directly to her preferred pharmacist. Ms. Dorr said these online appointments could take her less than 15 minutes, compared with about 2 hours if she had to physically visit the GP. A lot of doctors' practices you ring up and it will be 24 or 48 hours before you can get an appointment. You won't get in on time and you'll usually have to wait, Ms. Dorr said. I can just say to the guys, I'm off online for 10 minutes. I'll see you back here shortly. Founder of GP2U, James Freeman, said the service was now delivering about 197,000 consults a year, including 50,000 psychiatry sessions. Some of its clients are from areas facing dire GP shortages such as holiday towns in Queensland and Mount Gambier in regional South Australia, he said. While there are Medicare rebates for people in parts of country Australia to consult specialists via video, there are no subsidies for people wanting to contact their GP this way. A spokesperson from the Australian Government Department of Health said when the specialist rebates were established in 2011, medical groups strongly advised that face-to-face consultations with a GP was the gold standard of care. This means that Ms. Dorr pays about $70 out of pocket to see her online doctor, and that the expansion of virtual medicine into mainstream clinics has been limited. Dr. Freeman said these funding restrictions were not just an issue for younger people, more accustomed to accessing and using services online, but also for Australia's growing aging population, who will need to increasingly access healthcare services at home. Dr. Loy also said more work needed to be done to encourage medical students to take up jobs as general practitioners, in order to meet the desire for out-of-hours appointments.